someone has PTSD, it's pretty common that they end up on SSRIs, Prozac, Lexapro, Celexa, as well as other drugs. Like we'll put them on benzos for breakthrough panic and stuff like that. Reality is you can't process when you're suppressing the experience. So these drugs numb people out. And so they're not actually engaging in the feeling itself. And if you're not engaging with it, how can you expect to move past it? Two, they think they're getting better, but really just not how it works, right? People think that trauma is strictly a mental issue. And the reality is that trauma is stored in the body. And so we can't treat trauma effectively through, right? So we need to get people away from the pharmaceutical approach to treating trauma. Also, that's part of why people remain stuck too. They think they're getting better, but really they're just medicated, right? I've seen it take people from a position where they couldn't leave their house because of fear and trauma to a place where they're connected with their community. I've seen it save people from dying from fentanyl and heroin. Like if these things were meant to be limited, then they wouldn't grow from the fucking ground. Yeah, my name's Noah Carroll. I made the trek down to the DC area from where I live in southeastern PA, like an hour outside of Philly, because psychedelic assisted healing and trauma recovery are critically important topics near and dear to my heart. And I wanted to come here and talk about my own story, what kind of got me to this place, and try to offer information that can be valuable to the community at large. So when it comes to myself, in this moment, I'm a licensed clinical social worker. I'm a psychotherapist in private practice, working out of a small town called Chester Springs, like right outside Philly, with a pretty diverse population of people, everything from anxiety and depression, these kind of two monolithic issues that seem so present in modern day America, to complex trauma, PTSD, substance dependence, really the whole gambit, right? And what got me to that place is a long and complicated story. But I think critically for me, part of that is my own experience, my own life. What I went through, I think, informs my practice, helps me connect with people in a more genuine and authentic way, right? And so what that is, I have my own mental health history, I think, as we all do, including really serious addiction to opiates, dating back to the early 2000s, 2004-ish. For many years, I became addicted after a surgery. And back then, it's the height of the opiate epidemic, and prescribers were just dumping pills onto people. I remember walking out of my outpatient appointment with 90 Vicodin and 30 Oxy and 60 Perks, just a pile of pills. And it's no wonder that with no support in place to come off of that, because they didn't walk you down back then, just like millions of other Americans, I became completely dependent, physically dependent and addicted to these pharmaceuticals, and had to find my own way out of that, right? So I worked 12-step. That personally didn't work for me, kept me clean for a little while, but my experience getting away from pharmaceuticals really was, honestly, it was more experiential. It was more rooted in like the mind-body connection. I found fitness through rock climbing. That became my life. And it changed everything. I meet with people now in the work that I do, bringing my own experience to the room, I think is part of what's different about my approach to psychotherapy, right? I'm not like a monolithic wall. One of the first things that I say to people when they come in for their first meeting, it wouldn't be fair of me to expect them to sit in the couch across from me and somehow magically turn on the vulnerability switch and be completely open and bleeding out to me. So sharing my own story, my own pain, my own process when it seems appropriate and like it would be helpful is part of the work. Plant-based medicine has been a part of my life for a long time and may remain a part of my life despite my addiction and dependency to pharmaceuticals. Psychedelics have been a part of my life for a really long time, dating back to honestly my teenage years. And I want to draw a distinction, obviously, between psychedelic use for recreational purposes and psychedelic use for healing and medicinal purposes, because it's really important to do that. I think that psilocybin in particular, as a plant medicine and true classic psychedelic, holds a special place, and that the opportunity for like real systems level cultural healing can occur through its usage in a careful and intentional way. I think there's a huge amount of misunderstanding about trauma, and a lot of it's rooted in the way that we used to treat trauma, and in fact, the way that a big portion of the psych community and the mental health space continues to attempt to treat trauma, right? So if you look at the way that trauma is treated through the older modalities like cognitive behavior therapy, there's this misunderstanding that somehow you can outthink it, right? That we can somehow use our brain to make it go away. We can somehow trick it cognitively into going away. And that's just not how it works, right? People think that trauma is strictly a mental issue. And the reality is that trauma is stored in the body. And so we can't treat trauma effectively through cognitive tricks. We have to engage the body for treatment of trauma to be really effective. What that looks like can vary. There's a whole bunch of different approaches to doing that. But broadly speaking, that's, I think, probably the biggest misunderstanding around trauma, is that somehow it's cognitive, and it's really not. And I think a lot of damage is being done actually through the older school approaches to treating trauma. One of the ways that CBT would have us do it is through this idea of exposure therapy, right? So let's say you're in a car accident and you're traumatized by that. CBT would pose, okay, we're going to slowly expose you to the thing that scares you in the first place, right? And you can reduce the symptoms of the issue, but it's still going to live in the body. And people end up freaking out because the approach itself is re-traumatizing. We could start with like a picture of a car accident. And ultimately, we want to get you in a car or have you actually witness a car accident in this framework, in the old school method, right? So it's super common to put people who have PTSD. It's pretty common that they end up on SSRIs, like, Prozac, Lexapro, Celexa, as well as other drugs. Like we'll put them on benzos for breakthrough panic and stuff like that. And the reality is you can't process when you're suppressing the experience. So these drugs numb people out. And so they're not actually engaging in the feeling itself. And if you're not engaging with it, how can you expect to move past it, right? So we need to get people away from the pharmaceutical approach to treating trauma. Also, that's part of why people remain stuck too. They think they're getting better, but really they're just medicated, right? And I do this, don't get me wrong, I'm not trying to shit on CBT. It does have its purpose. It's just that its scope is narrow, right? I have these printouts, and it might have a table on the printout, and it'll say in one column, trigger, and then next to it, how intense was your reaction? 0 to 10. Totally valuable, right? Good to know. And then it'll say something like more realistic reappraisal. And what CBT wants you to do is it wants you to cognitively, that is using your thought process, come up with a more grounded reappraisal of the situation, right? Like a less catastrophic version of whatever it is that you're just experienced because of the trigger. And that's valuable, but part of the issue is that the response to triggering situations in people who are traumatized doesn't just happen in the brain. It also happens in the body. And so we have to find a way to work through that. And so somatic therapies attempt to do that. And honestly, I think they do it really well, the ones that we have. And the same is true for experiential, right? Experiential therapies don't exist strictly in the thought material. I can give you an example, right? So experiential therapies draw from things like creativity. We would want people in an experiential session. I might have someone laying down on the couch with their eyes closed. We'll do a bunch of breath work just to get grounded. And we'll try to tap into parts of their inner self through guided prompts. So that might be like, can you locate in your body the part of you that feels afraid, right? And it's not meant to be judgy. That part has a real job to do. It's trying to keep that person safe. It feels afraid for a reason. And people will find it. They'll actually find where they feel the fear physically in the body. And we can tap into creativity from there and move to things like, if this part of you, can you imagine what this part of you might look like? Is it an older version of yourself? Does it have a color? Does it have a texture? Does it have a temperature? Does it have a pace, a rhythm, a speed, a tempo? It's getting people in touch with their inner landscape through a non-judgmental lens, a lens that views these parts that might feel bad as actually valuable contributors to their system. That's completely different than give me a realistic reappraisal of the triggering instance, right? Somatic therapies, guided experiential therapies walk people through processes that result in real transformative long-term change. Cognitive behavioral therapy can do that too, but part of the reason people are burning out is that it often can actually connect to in a more genuine way. In some ways, it's my experience, right? So I can speak to what I have experienced with the potential of psilocybin, and that feels more connected to me than someone else's experience witnessing somebody else. Professionally, we're in a weird spot when it comes to psychedelics, right? As a therapist, I hold licensure in PA and other states too, a few other states also. If I go around to the people that I work with, my clients, and directly recommend psilocybin to them, I could lose my license. So it's a super gray area that we're in, where we know, those of us who are paying attention, that these medicines work, and yet we can't directly recommend them to people. I mean, I've seen it save people's lives. I've seen it take people from a position where they couldn't leave their house because of fear and trauma to a place where they're connected with their community. I've seen it save people from dying from fentanyl and heroin. And I've also seen it, because these are extreme examples, I've also seen it regularly clean out the cobwebs for people who are more operating at, I guess we could call it a baseline, right? There's a big difference between I can't get out of bed and I'm suffering, which is the human condition, and going to work and meeting my needs, but still suffering. And I've seen it for those people who are able to meet their day-to-day needs and function in society as like a rejuvenation, a reconnection with core self, a reconnection with the natural world. I'm a huge proponent of psilocybin in nature. I think there's a complete difference. I don't think this is a medicine that we should be administering in a clinical sterile setting, because people will freak out and it won't be great. I think we need to be doing it. This is like a plant-based organism, and we should be connecting with where it came from. And we're missing that in society anyway. That's super valuable too, right? So yeah, at like a political level, people remain skeptical of psychedelics broadly because of propaganda. And that propaganda has a really clear, in my opinion, purpose. So in my view, a capitalist society doesn't want people engaged, not just capitalism, but specifically this Western incarnation, doesn't want people engaging in psychedelics, partially because they're so opening, right? So if we continue to be the cogs in the machine that we are, that works great for the system, right? The system wants us to be oppressed. That's in the design. And psychedelics are an excellent tool for breaking the chains of oppression, because they open up people so profoundly that you start to see the framework, right? And so really hard time physiologically overdosing on a psychedelic. It's just not going to happen, right? And we know that. Just go out and Google it. So in terms of the actual physical risk, I don't really see any reason for them to be illegal in the first place. Is there a risk to psyche? I think that people like to make the argument that there is a risk to psyche. This whole idea of the bad trip, I think, is part of that. But in the work that I do and in the way that I talk about psychedelics from a therapeutic perspective, I would push back and say there's no such thing as a bad trip, period. Because people describe bad trips as anxiety, I feel bad in my body, in a thought loop, right? They get overwhelmed by the visuals, the cognitive distortions that can kind of take place can be scary. But the thing is, in the right hand, you want to move toward that thing, right? The scary isn't bad. The scary is good. What we classically view as bad trips are actually good trips. That's the truth, right? And so if the medicine gives you an opportunity to confront this thing that's actually in you, it's not creating the experience, you are. If it gives you the opportunity to confront this scary thing that's actually, you should take it, right? And so even in terms of damage to psyche, no, I don't believe in that. I think irresponsible usage could result in problematic experiences, but informed, intentional, attuned usage, there's no such thing as a bad trip. We have to turn not toward the Western medical model, but toward the cultures in which these medicines have been used for thousands of years, right? And we need to try to do that in a way that's not appropriating or co-opting and exploiting this ancient knowledge, but that is at the same time, with respect, trying to access and utilize it, because these medicines have been around for as long as humanity has, and there are cultures on this planet that know how to effectively balance safety, ethics, and responsibility with access. And in my opinion, that's where we should be turning, right? Will that actually happen in America? Probably not. And so the realistic answer to that question is that I think we just need to try to do the best that we can to treat these substances with the reverence and respect that they deserve. And at the same time, like, if these things were meant to be limited, then they wouldn't grow from the fucking ground, right? Is it actually up to the structure, the power structure, to regulate our access to these things? In some ways, you're asking me a human rights question, right? Does the government have the authority to tell me that I can't pick and consume a mushroom? If you stop and think about that at a fundamental level, doesn't it seem ridiculous? I mean, who am I to say how we should be limiting it in terms of access? I'm not even sure that we should be limiting it in terms of access. Do I want kids running around and eating psilocybin mushrooms? No. But isn't it up to the communities to help figure that out, right? Is a responsible community going to allow children to run around and just eat psilocybin mushrooms? No, of course not. I think part of the answer to the accessibility question is ideally it should be at a community level. I think we need to take them really, really seriously, right? These are substances that are so profoundly powerful that they can change your outlook on the universe. So should we be treating them willy-nilly like we've done with cannabis? No. I think it's our ethical obligation to take them seriously. Does that mean we need to limit access? No, I think it means we need to bump up education, basically. The other part was safety. Yeah, I think I touched on that like there isn't really any physical risk with these substances, and that in responsible and intentional usage, I don't see a risk to psyche either. And so I think the answer to that question also is essentially education, right? That like, if I wouldn't want anyone to just go out and pick up psilocybin mushrooms and take them without having any idea what they're doing. That's certainly dangerous to psyche, right? Is it going to fuck you up forever? No. Will you have a really difficult night? Probably. But do I want that for anyone? No. So I think we need to have a real effort toward educating the public about how profoundly powerful these medicines are, and that's part of safety. I think what gives me hope is that things seem to actually be changing. I think we spent a long time locked down in this old paradigm, and that we're in a moment now that feels to me like there's a renaissance happening, and it's not just oriented around psychedelics. Honestly, a big bulk, maybe the biggest bulk of my caseload right now, is made up of people, and probably 90% of the calls that I get at this point for intake are people who have burnt out on traditional talk therapy, still have work to do. So that gives me hope that there does seem to be this shift taking place away from the old school kind of maintenance model of like, let's get you medicated and everything will be okay approach to mental health and wellness. And at the same time, that's happening in terms of people looking for different therapeutic modalities. Here, I'll plug EMDR for trauma therapy, internal family systems, also great for trauma, acceptance and commitment therapy, another really good model. These are all totally different than what people are used to when they go to traditional talk therapy and talk to a CBT therapist, or even just a traditional psychodynamic talk therapist. These other models are really different. I could spend hours talking about how they're different. I think what I'll do is just put the names out there, right? And EMDR stands for eye movement desensitization and reprocessing. So these three, EMDR, IFS, and ACT. And there are others, but people are looking now, and it didn't really used to be that way. And part of that's around education and access of information through the internet. The times are changing, and that's hopeful. They're changing in terms of what people are looking for, but they're also changing in terms of like how people are taking care of themselves. I think people are becoming increasingly attuned to the importance of diet, exposure to the sun, actually getting out of the house and touching real grass, the importance of community connection. I had a graduate school. My first 7 years, I did mobile family therapy as a lead clinician in Philly, just really in the trenches, real social work. And it was awesome, but people are still stuck because the system wants them stuck, right? And so I'd like to have more hope for those people. Actually, I think that psilocybin would probably be really good there as well, because it's so opening. The idea that the ghetto traps you is a mindset as well as a socioeconomic and structural issue. And there can be a change in mindset that comes along with these medicines. And so I would like to have hope there. I think even, again, just having the talk in the first place is good reason for that. So website for me is www.insight, INSIGHT therapy.net. You can also get me at wilderness-therapy.com.